We're going to do one more thing. We're just going to shift gears completely. I've talked pretty much all about delegation at this point, but I really haven't talked much about assignment making yet. So assignment making is very, very similar to delegation in the sense that we have to have a really good understanding of everyone's scope of practice. And you will see assignment making questions very often on NCLEX as well. And these questions are asking you to determine an appropriate assignment for another RN or for an LVN. So let's do one of those together and get a little more practice and familiarity with this type of item, because there's a good chance you'll also see it on NCLEX. So it says a charge nurse is making client assignments for a critical care step-down unit. Which client would be most appropriate to assign to a new graduate registered nurse? So before I go ahead and confuse anybody, I just want to reiterate, the RN technically can care for any of these clients. Remember, the RN scope of practice is we can care for anyone, no matter how stable or unstable they are. But remember, guys, we are in a fancy, perfect NCLEX hospital where staffing is amazing. And so we're saying which is most appropriate. So let's take a look at the options. A client admitted for diabetic ketoacidosis on an insulin drip, a client who is scheduled for discharge today with a new colostomy, a client who is scheduled for a pacemaker insertion procedure during the shift, and a client admitted for post-operative infection who is receiving IV antibiotics. So let's take a closer look at each option. Option 1, a client admitted for DKA on an insulin drip, which means IV insulin. So do you want to assign the client in option 1 to a new graduate registered nurse? I think that we should probably try to find a more experienced nurse for this client, and let me tell you why. We know that DKA is a life-threatening complication of diabetes, and it is a very complex care plan. And we know that IV insulin is one of the highest risk medications we will ever give. It is a very, very potent medication. For example, if you're not very familiar with the IV system and you accidentally bolus an insulin drip, there is a very high likelihood your patient is going to code and potentially die. So it is a very, very high risk drug. But also, we know that it really affects the electrolytes. So whenever a client is getting IV insulin, their potassium level is fluctuating the entire time. So if we don't very closely monitor this client and we're not very careful, they can have cardiac complications as a result of potassium abnormalities. So we know just by having that really brief discussion, this is a very complex care plan. So we would want a more experienced nurse to care for this client if possible. So option 2, client scheduled for discharge today with a new colostomy. So do we want to assign the client in option 2 to a new graduate nurse? Yes or no? They seem pretty stable if they're being discharged today, right? So why would we not want to assign them to a new graduate nurse? Well, we have to look at that keyword, new colostomy. With a new colostomy, what is that going to require? A lot of education. So this client typically needs a lot of information on care of the site to prevent excoriation or infection, but also a lot of psychosocial teaching to help them adjust to this big change in their appearance. And so really, it's ideal to have a more experienced nurse that is very familiar with wound care and colostomies. I don't think it's the best option for a new grad nurse. So option 3, a client scheduled for pacemaker insertion. So a client that is getting a pacemaker insertion, when they come back, they're at very high risk for cardiac arrhythmias. Sometimes that pacemaker doesn't properly pick up right away. They might have issues with cardiac output. So we really, really want a nurse here that has a lot of experience with ECG rhythm interpretation. So it's best if an experienced nurse is able to care for a client post-pacemaker insertion. So I know you guys have been telling me option 4 is the correct answer for a while now, and I agree with you guys. And the reason for that is because it is the most simple care plan. So that's really what we're looking for. With a new graduate nurse, of course, new grad nurses have tons of experience and knowledge and they're very smart, but we want to make sure that they are assigned the simplest care plan if possible, because that is going to be what is safest for both that nurse and that client. So a client that's got a post-operative infection with IV antibiotics is a very simple care plan that would be appropriate. Now, let me give you an example of when this maybe wouldn't be correct. So a client admitted for a post-operative infection who is receiving IV antibiotics, who has tachycardia, hypotension, and an elevated lactic acid level. So this is just a bonus question because you guys are doing so well. I want to try to challenge y'all just a little bit. If you have a client that has an infection that has tachycardia, hypotension, and an elevated lactic acid level, what is going on? Those are all indicators of sepsis. So certainly sepsis is a very complex care plan that it typically involves central line, hemodynamic monitoring, vasopressors, titrating medication. So that would be something also that would be assigned to a more experienced nurse. Once again, that is the correct answer. Y'all are doing awesome.